one of the things that I think is a problem with American healthcare, and some people call it original sin, is employer-based healthcare. This is one thing that separates the US from so many other countries and has proven to be a very ineffectual model in many ways.
It's like people stick around in their jobs for like 2 or 3 years. So who's incentivized to care about their long-term health? Maybe the answer is nobody. And that's the fundamental alignment issue that we have.
People are willing to, I don't want to say overpay because that's not the right term here. In a system where you were voluntarily paying someone $50 or $75 a month to get your treatment, you're doing that because you recognize the value.
Meanwhile, employers, they are offering annual physicals. They're offering access to blood work through insurance for free. And people are not availing themselves of these benefits.
I am a pragmatist and I really love the idea of bipartisan collaboration between the parties to achieve large milestone type events in healthcare.
This is Second Opinion. I'm Christina Farr.
I'm Zenooz. And I'm Luba Greenwood.
Welcome to the pod, where each week we navigate what's really going on in healthcare through strikingly candid conversations with the entrepreneurs and investors leading the charge.
Thanks for joining us. Let's dive in.
Hi, everybody. Welcome to Second Opinion. We have got an amazing episode coming up. And once again, I'm joined with my co-host, Zenooz, and Stephen Buck, who's a longtime friend of mine. I'm so excited that he was willing to join the pod. Steve wears many hats. He's been an entrepreneur. He does a little bit of investing. He's an operator. He's started a company in the oncology space. He's worked at businesses like Roe, where he ran their pharmacy business. He's worked at GoodRx. He's been at McKesson, so he knows the underbelly of healthcare. And he is somebody that I regularly called when I was in my media life to just get answers on questions of why healthcare is so messed up, to have somebody who could actually explain it to me in plain English. So I was very excited to have him on the pod and really just dig into what he's seeing right now in healthcare, specifically as it pertains to this direct-to-consumer trend that Steve has been following now for years. Okay, I'm going to start by just asking you a question that's a little bit more personal because we love to just like dive right in here on Second Opinion. But Steve, tell us a little bit more about your politics and how your politics drives your thinking about healthcare and the way that the system should operate.
I love that question because I always tell everyone that nobody likes my politics at all because I am a pragmatist and I really love the idea of bipartisan collaboration between the parties to achieve large milestone type events in healthcare, such as the passage of Medicare, such as some of the most important things that we've done in this country for civil rights. That I think that it's only through political change of the two parties coming together that we can really achieve systematic reform. That I do not think that one party cramming down legislation that the other party then gets in office and tries to unwind is going to lead to the type of change that I think that most people would like to see from our healthcare system, that covers everyone, that has reasonable costs, that doesn't have a lot of the conflicts of interest that make healthcare so difficult, that there are so many hidden conflicts of interest and corruption in some cases in our system that I think Americans, if you talk to regular people, I think there's a lot of common sense ideas, but because of the way that our politics are today, if you're a Democrat and you want to collaborate with Republicans or vice versa, your party will excoriate you. You will be challenged in a primary. You will not get anywhere. And I do think that there are some people on either side who say, no, the other side is the one that needs to bend and to bend to my will. That's not sustainable, in my opinion. And it's a very unpopular view because everyone I talk to is either on one of those sides where they're like, no, my party needs to win. It's the other party that's awful. I don't think that. I think that there are actually good ideas. And we were actually at a moment in time, no one really talks about it any longer, but in 2008 or so, when Obama was elected, there had been a proposed set of legislative changes called the Healthy Americans Act. And it was actually a bipartisan effort. And there were many actually, people with diverse kind of political leanings that had sponsored this in the Senate. And there was an opportunity to get rid of one of the things that I think is a problem with American healthcare, and some people call it original sin, is employer-based healthcare. that this is one thing that separates the US from so many other countries and has proven to be a very ineffectual model in many ways when you look at it from a cost and coverage standpoint and an outcomes perspective. You can use life expectancy, you can use so many different measures of how flawed our system is when you compare us to Australia, New Zealand, Switzerland. And that's not to say that those systems don't have their problems, and they do, but I think that in order to get back to that level of collaboration that we had between parties, there's going to need to be some changes to the way people demand things of their politicians. And I don't know that that's easy. I mean, in the world in which we live in today, I'm an independent. I'm not registered in either party. I vote for the candidates that I think are going to do a good job. And so I get, again, I have a very unpopular view because I'm not aligned with the party. So people think, oh, geez, I can't, why don't you just join my party and come with me in order to get this done? And I just don't think that'll work.
Steve, it's interesting. I just want to say, I worked in the Senate as a policy fellow in 2015, 2016. And there's been a sizable, like seismic level change in how the parties operate and function with each other since my time, which was not that long ago. To your point, I saw a very collaborative approach to like bringing various laws to be evaluated or discussed on the Senate floor. People exchanged gifts. I saw senators come to each other's offices and have conversations, sometimes, excited conversations, but at the end of the day, they left shaking hands. It was very visible. And after hours, you would see folks getting together and having a drink or sharing gifts. That just doesn't seem to exist anymore.
I totally agree, Ash. And I think that if you're a Republican and you say, hey, you know what? I didn't like the way the ACA was drafted, but I can live with it now. And I think we can make some improvements to it. That's like a radical position that will get you a primary opponent within the Republican Party today. If you do not advocate a rip out the ACA and destroy it, you're going to get somebody who's going to challenge you. And likewise, I would say there are people that I get frustrated with on the extreme wing of the Democratic Party that advocate for a government only solution. And Bernie Sanders is getting a lot of people coming to his rallies, but I vehemently oppose most of the ideas he has for redoing healthcare that involve more kind of government ownership of hospitals or systems or extreme regulations. When you compare them, his ideas, to those that are employed in Germany or France or Switzerland, they're very extreme compared to those systems that have a lot of private ownership and competition, things that I think are good, but also balance those with guaranteed coverage, and also ensuring that if you can't afford care and premiums, they will be subsidized. So I think that there's this pragmatic solution that allows people to still make money, that still allows, I think doctors should be paid a lot of money. That's one thing that I think that I disagree with, how England does it and how their system is, the pay is very, very marginal, in my opinion, for what doctors do, and nurses in particular. That I think that those things are acceptable. So I think there's a room to get cost out of the system that's not on the backs of doctors and nurses.
I did want to ask you, Stephen, like to that point, I've heard people say that maybe the solution is a consumer kind of free market, low price offering for most things in healthcare. Like if what you did with Roe, essentially, like if you want to buy your weight loss medications, or you want to get an antidepressant that's a generic, or you want to just get a quick consult, maybe you just pay cash. And then, there's also a system that needs to exist that is a form of insurance for the more catastrophic, high cost events. And that system needs to be attached to something that's more long term. Because right now, what you mentioned with the employer, it's like people stick around in their jobs for like 2 or 3 years. So who's incentivized to care about their long term health? Maybe the answer is nobody. And that's the fundamental alignment issue that we have. So would love your reactions to that idea.
I totally agree. And these ideas for how to solve this, they've literally been around, what you've outlined, for 50 years, that no one has been able to build that political coalition and the compromise that it would take. You would need, and Ash, you probably know this better than anyone, right? You would need 60 senators plus to do this, that all are agreeing. You would need a fair majority in the House, more than like 2 votes, in order to make this stick. And you would need a president that could do it in a way that didn't threaten the other party to where they would be, it's so complicated and hard. And yet healthcare tends to pop up as a top five voting issue for many. And so I do agree there are things that are interesting about consumerism. And sometimes this issue, again, it gets polarizing because people say, well, that's not fair that people should have to have a deductible and have to shop around, that we should just make everything free for everyone. And I do think that in the grand scheme of things, that competition is extremely important to continue to raise the quality, to ensure that the quality doesn't drop. When people don't have that, competition between suppliers, whether it's in any industry. I mean, we know this from so many consumer industries, that quality and care, it can decline in a way that is not keeping kind of track with the level of innovation possible to make sure that we are seeing better outcomes, better, faster, cheaper, everything that happens in we expect from many other industries where there's good competition. And the biggest philosophical issue on the left, I do think, is private competition and profits. On the right, I think it is the idea that there is a guaranteed to healthcare, that there are people on the right who are like, there should never be a guarantee for healthcare for Americans, period. That I will never support something that makes it that everyone gets covered and everyone has a right to healthcare. So you have those two extremes that I think we're constantly having to battle against when we're formulating this type of a new health system or idea.
Well, I mean, obviously we've seen an evolution to your point, Steve, from like in direct to consumer, right? It started off with ED and hair loss, and now it's sort of become a very robust industry. What do you think is fueling this like rise of cash pay DTC models here?
Well, it's really interesting because in those categories, it was really the hassle factor of getting access to some of these therapies that for many people, especially when you think back about ED and other conditions, it was something that people were either embarrassed to talk about or they didn't have a regular primary care doctor. And there were those out there that could help them to get access to therapies that were clinically appropriate in a way that was quick and easy and private, and so much so that I think you can look at Hims's performance from a public standpoint because those financials are obviously public and they're out there, that people are willing to, I don't want to say overpay because that's not the right term here, in a system where you were voluntarily paying someone $50 or $75 a month to get your treatment. You're doing that because you recognize the value. And others may say, well, geez, you could get that medication for $5 if you went to another pharmacy. That's not what people are paying for. They're paying for this service and access in a concierge like way where they know it's going to be reliable, it's going to be a good experience. And that is now happening in many other areas. And GLP-1s being now the biggest example of that.
But do you think that this is creating more of a haves and have nots, or do you think it's actually broadening access at lower priced drugs and care for the broader population? How sustainable is this?
Yeah, it's a great question because yes and no. I mean, the costs, they may seem higher than if you went to your primary care doctor, but that assumes you don't have a copay, first of all. So and it assumes you can get in when you need to, and it assumes like some other factors. So yes, people are paying for that kind of faster, easier experience. And the question is that for every condition? Probably not, because there's a lot of people who are seeing their primary care doctors in addition to using these services so they can balance. And this is actually something I know very well, that people may choose to get their statin medication from their primary care doctor and their ED medication from a service like Roe or Hims. And so there's that balancing for different conditions. I do think it's good though for the ecosystem to have this competition. It's a question of how large should that deductible be for a lot of things. Obviously, for Medicaid patients, the people who can afford this the least, everything is a dollar, right? Everything is free. So that population that's most vulnerable financially. So the question becomes a one about middle class expenditures, and I do think middle class can look at some of these solutions and decide for themselves if they want to pay or go through the primary care system they have access to. And with GLP-1s, I think this is really interesting because those were therapies that doctors were maybe not as familiar with at first or not thinking about for obesity, and it was very new. And then patients had trouble with doctors that may have not been willing to support the titration process and so forth. So these companies may have in many cases become a lifesaver to people who were not losing weight, not successful, and comes the company was like, no, we'll hold your hand through this journey. We'll make sure if you're having side effects and issues, we're there for you. Unlike a primary care doctor where you got one appointment a year. That's how often I see my primary care doctor once a year, and they say come back the next year.
Hey everyone, we'll get right back to the conversation after a word from our sponsors. Today, I'm excited to share a true scientific breakthrough for your long-term health. C15, the first essential fatty acid discovered in 90 years, and it's 3 times better, broader, and safer than omega-3. Dr. Stephanie Van Watson discovered C15 while working with the US Navy to improve the health of aging dolphins. Here's why this matters. Many of us are deficient in C15, resulting in weaker cells that make less energy and quit working earlier than they should. This makes us age faster, sleep poorly, and feel sluggish. C15 is a science-backed, vegan-friendly supplement with pure C15 as its only ingredient. It strengthens your cells, improves mitochondrial function, and protects against damaging free radicals, supporting better metabolic, heart, and liver health, plus deeper sleep and healthier hair, skin, and nails. Unlike fish oil supplements that often go bad, Fatty 15 naturally protects against oxidation. It even comes in a beautiful reusable glass and bamboo jar with eco-friendly refills. Ready to restore your long-term health? Get 15% off your 90-day subscription starter kit at fatty15.com/secondopinion using code secondopinion at checkout. Yeah, so I'm curious about like some of these companies. I've been tracking the longevity space pretty closely, and it's astonishing to me. These companies are offering lab tests, access to biomarkers as well as health coaching, and in some cases a one-on-one relationship with a clinician. And people pay a lot of money to use these services, like $40, $50 out of pocket a month for 6 months, a year, longer. Meanwhile, employers, you mentioned employers in the original sin, they are offering annual physicals. They're offering access to blood work through insurance for free. And people are not availing themselves of these benefits. We've seen since COVID just a total plummeting of prevention being done at workforces, some of it due to this challenge related to remote work, some of it because we just kind of, I think we unwound some learned behaviors and habits in a way that we haven't been able to rectify. And I think it's probably also a communication problem. But one thing that has struck me, and I apologize for the long-winded question, but there's something aspirational to me about longevity. It's like very positive. It's like health optimization, it's lifespan, it's functioning at your peak. And then it's, when you contrast that with public health, it can sometimes feel a bit more negative. Like it's a way to prevent disease. And people don't seem to resonate with that as much. So I wonder if there's a way for the system to like learn the lessons of branding from these longevity companies, and what thoughts do you have on that?
Well, so I think about this question a lot. It's a really interesting one because I've been someone who's followed the longevity space for quite some time, and I find it super interesting personally. I think a lot of the things that they've started to talk about are great. But here's the thing. I think there's some weird, I won't say weird, but this nation is so diverse when it comes to views about life and longevity. And what I mean by that is I'll never forget walking around someplace one day and seeing a gentleman with a t-shirt that said on the back of it, I'm not here for a long time, but I'm here for a good time. And think about that as a motto that you wear around on a t-shirt. There are people, they're basically saying, you know what, I know I'm not going to live till 100. I'm not going to live to maybe even 80, but I'm going to live my life in a way that I find to be fun. And that may be over consuming food, alcohol, living in a way that no one tells me how to live my life. And that is part of, I think, the DNA of this country culturally for a lot of people. And getting going to talk to them about, hey, maybe you should eat some more vegetables and instead of eating the processed foods, they're going to look at you like you're crazy and say, I don't even want to listen to what my doctor tells me to do sometimes. That they're, and that's, I'm not saying this because I'm judging in any way. I'm not. I'm not saying that's right or wrong. I'm just saying when you meet people where they're at, they may be at a very different place, and then there may be others who are highly educated. I'm not saying the people who have that view are not educated, by the way. I want to be very careful, but I want to say that there are others who say, like, no, I want to be very physical, have a good health span, and I want to be active into my 90s, and I want to do the things, whether it's optimizing protein consumption, not just eating it all at once, but spacing it out in the day. And are you thinking about liquid proteins versus food proteins? And all of that science is fascinating about building muscle and all the things we could be doing. I obsess over things like footfalls, like how strong are your ankles? Because if you're not strong and you're 82 years old and you start tripping, you can die. And so I think that there's a great opportunity to get that into the mainstream of healthcare more. And it's interesting because, as I was describing, I have my annual physical with my doctor, and I start talking about some of these concepts of longevity and things like that. And he's younger than me. So he kind of looked at me one time and said, "You're the healthiest patient I have. You don't know what I'm dealing with in terms of the kind of challenges to get people." And it was kind of like a way of saying, like, you may be over, but he said, then I have to meet my patients where they're at. And I understand that you're into these types of topics. So it's interesting when you talk about, Christy, as this longevity message matriculates its way into the broader population, they may be approaching physicians. And my doctor's a great doctor. I'm in a very well-known health system here where I live in San Diego. They're just like, what do you want me to do, essentially? And so we may start to overwhelm the system, and they say, I only have one visit with you a year. We can do follow-up lab testing. And I'm asking him, like, well, shouldn't I be fasting for these things? He's like, look, your glucose level without fasting is this low. You don't need fasting. And it's interesting how different patients have different experiences.
Is it because we need to have the government involved in regulating what goes into our foods, like the conversations that are ongoing right now? Is it that medical schools need to change how they train their clinicians to talk more about prevention versus, sickness? Is it, what is it? Is it early childhood education and we need to like add nutrition to the curriculum?
I love that. So the thing I'm against, typically, I do lean very much more against most forms of government regulation here. I believe the government can do a good job of enforcing regulations, but I do think overregulation doesn't necessarily lead to success. I do think education of people, especially in schools, nutrition and statistics are things that I often ask, like, how much education do high school students get when they're thinking about nutrition and education? And I know it's been changing, and we've needed to change that from a public health perspective. But I do think in medicine, it's really interesting because it takes longer sometimes for the information to matriculate down to primary care physicians in particular. And I'll tell you a quick story that I think may be enlightening in this regard. So I do have a condition that I treat, which is gout. It's something inherited in my family, and I first started experiencing it in my 40s. And I went through a process of, like, talking to my primary care doctor, and they're like, "Oh, you don't need to do anything about it. It's okay. It's just maybe don't eat so much shellfish or something like that." And then I kept getting attacks. Well, I finally sought out a top 10 rheumatologist in the country at one of these institutions. And it was alarming to me when they said, "Oh my gosh, 70% of gout patients are not being treated correctly. Primary care physicians don't know what they're doing." And it was this whole thing. And here's how it takes an average for a gout patient 4 titrations to get them stable on a uric acid lowering therapy. And so it's, to me, that was eye opening about how, if you're not sometimes doing your research as a consumer, and also seeing how our system doesn't pay a doctor to do those 4 titrations necessarily, or they don't even, in some cases, they didn't even know. And it was eye opening. And it said, well, this doctor, by the way, wanted to start a business, also like a business like a row or a Hims for gout therapies. And the challenge was clearly that not a lot of people are searching for gout therapies. And so it's a good example of when consumerism doesn't work. And in the case of some of these, certain needs, people are searching those out. But a lot of people are just kind of going day to day. If they're not like a super educated consumer in this regard, they're going to get suboptimal outcomes for a long period of time in their health.
Maybe this is where ChatGPT for patients and ChatGPT for doctors could be super valuable to add. Chrissy, you and I have talked about this on other podcasts as a co-pilot to both patients and clinicians.
And I think to this point of, the lack of education in schools, I think it's sort of imperative that people do learn how the system really works and the level of misalignment of incentives. And we should be explaining some of these challenges around, churn and why your health plan isn't necessarily motivated to care about you in the long term. And so it becomes you that, you're the one in the driver's seat for better or for worse in this system. And I think that's now like increasingly a key thing we need to educate on.
I think my doctor thought I was crazy when I tried to give him my DEXA scans to look at. I'm like, I got these DEXA scans. Don't you want to look at them and see how much, visceral fat I have and talk to me about this? And he's like,
He's got about 6 minutes. So
yeah.
well, Stephen, I just want to say thank you so much for joining us on this week's edition of Second Opinion. We have to have you back because we didn't even get to touch on a million things that I would have wanted to talk to you about in the pharmacy space and the administration and beyond. So the first of many conversations, I hope. And thank you, Ash, for joining.
Nice to be here.
Thank you both.
Thanks for tuning in to Second Opinion. Share it with colleagues and friends and message us to let us know what topics you want to discuss on the podcast. If you want to support the show, the best ways are to leave a review wherever you're listening and make sure you are subscribed. And check out Christina's Second Opinion newsletter on Beehive. A link to subscribe is in the episode description. Second Opinion is part of Turpentine, the podcast network behind Turpentine DC, Age of Miracles, and more shows for experts by experts in tech.
Hey everyone, Eric here. At Turpentine, we're building the first media outlet for tech people by tech people. We're the network behind the show you're listening to right now. We have a slate of hit shows across a range of topics and industries, from our AI and investing cluster of podcasts to shows that drive the conversation in tech with the most interesting thinkers, founders, investors, and influencers, like Econ 102 with Noah Smith. We're launching new shows every week, and we're looking for industry-leading sponsors. If you think that might be you and your company, email me at ericaturpentine.co. That's ERIK at turpentine.co, and let's partner together.